No, is the person. Thanks, Katie. Is the person who's not on video. Do you want to introduce yourself? Okay. Well, I think the rest of us know each other, so let's get moving, yeah? Katie, I'm going to turn over to you to help kind of lead us in the right direction. I think we have to review some strategies and then maybe get to some tactics and stuff today.
Yeah, so I'll just share the agenda really quick. So pretty much what Leitner said, we left off with kind of talking about prioritizing our strategies. We have 3 left for today. So it's strategy 2, 6, and 1. And we'd love to get through those. And if there is time, we can start on tactics. If not, we'll handle that for June 22nd. So we'll meet June 22nd, and then the meeting after that will be July 20th, and we'll focus on finalizing our tactics. And then hopefully after that, we're done and we can move forward with, really getting this group going. So give me 1 second. I'm going to go ahead and drop the Jamboard link in the chat. And I believe it is page 13 is where we left off of, but let me make sure. I lied, it's page 9. So I'm going to share my screen again, and if you guys will, I'll jump on. And if you have any questions about how to use these tools, let us know. I think everybody was on this meeting last time. So we're just going to jump back into that. Joey, do you want to go ahead and start?
Yes, Katie, help me out because I always get a little disoriented with this. So we're on page 9. So I got to push my screen to 9 here. And we're looking at strategy 2. Okay, so strategy 2, I'll just review real quick because I can't, I can see Katie's screen, but I have to look at mine too, so it's a mess. But strategy 2 is public health agencies should create, maintain, and leverage cross-sectoral partnerships and coalitions that implement evidence-based strategies to promote physical activity. Okay, so last time we did this, it didn't come out super well. It came out lower than the rest, right? But how likely is it to be implemented? Got a 3.6. Do you think this can be implemented locally in the next 3 years? 3.6. I think that's pretty low for the stuff that we're doing, right? It seems like we can implement this in the 5 to 10 year range, more likely 4.2. And then how likely is it to improve physical activity and health? 3.7. So I guess for strategy 2, we again have this, matrix, right? So the top, easy and difficult, or easy and hard. And then on the left-hand side, if it's going to have a high or low impact. And, happy to chat about this too, if you guys have any questions or want to talk through it. I'm going to pull this little guy. And I'm going to say, this is me, but I'm don't let me influence your stuff. I'm going to say that this is pretty easy, but the impact is big.
Can I throw a thought in here?
Please.
So the strategy says public health agencies should create, maintain, and leverage. Do we want to put an or in there? So and or. Is it always a public health agency? So what are considered public health agencies? I mean, most people assume they're going to be health departments or something like that. Okay, so if we're making that assumption, do we want to add an or after the and? So they should create, maintain, and or leverage cross-sectoral partnerships and coalitions such as this. It's not led by a public health agency, but we're helping to move. We're a cross-sectoral partnership or coalition working to move this stuff forward. So, like you were just talking about with CHAWS and CHIPS, if health departments are doing what they have to based on funding, is this going to be a high priority? And so anyway, I know that's sort of tweaking the language just a little bit, but does that, in my mind, at least, that helps me get this to easier to implement.
Shelley, you actually mentioned that during our last meeting. And I meant to change this because I think we all agreed on it last time to add that or into the phrasing. I also want to
Okay.
apologize right now, guys. I jumped ahead a slide. We did this last time, so I don't know if we want to go ahead and just take a step back. Again, that was my fault. I apologize again. Last time we started with this and we discussed the strategies and how who can implement them, if there's barriers to success, how do we overcome those barriers, and who are we missing from the table before we did the chart.
I mean, I don't think it's gonna change how we feel, but yeah, we can start here if that works. So, I mean, so to Shelley's point, let's like wrap this up. To Shelley's point, I think last time or the time before last, I forget, we said that public health is like public health departments, right? That's how we're kind of phrasing this. Now, we all believe that public health, the big public health, big P public health, if you will, is like everybody, including CMH and nonprofits and all this stuff. But I think that like for this, we're really focused on like public health departments and like people who are like funded and to do like the essential services of public health, right? Yeah. So to Shelley's point, yeah, I think we should add that or. Yeah, I don't see a problem with that. Anybody else? Cool. All right, so is this already being done? I'm gonna say no for physical. How do I type in here? No for physical activity. What do you think? I don't think it's being done in KCMO. Then that's the area that I know the most.
I think there are bits and pieces that have been done in the past, but I'm not seeing this done anywhere else right now.
I think Johnson County might be the best, right?
Maybe.
Yeah, I mean, I don't think it's already, that's one thing that we're still, I think, working on. Definitely healthier eating. That's something that's we focused on for sure, but yeah, we're still working on it.
But I mean, from my lens, Sandy, I think that like Johnson County's more advanced than the rest of the area.
Yeah, sure.
Yeah. Okay, so if it's not being done, who can implement it? And I think that like, community health programs and local health departments are the people to do this, right? Anybody else? And the epidemiologist could be. Yes, could start some of this stuff and like the data and surveillance things, right? Because I mean, like if the cross-sectoral partnerships need data and evidence, then the epidemiology groups from all the health departments would be essential. Shelley? Oh, I thought you were, sorry, you're unmuted it, so I thought you were gonna say something.
Oh, sorry. I'll mute myself.
No, you're good, you're good. Anybody else? Who can implement this? Developing, maintaining cross-sector partnerships. This is the wrong strategy, Katie. These are two, sorry if you can hear that. The wind's like blowing through my apartment. These are two different ones. Strategy 2 is a workforce. Where strategy 2 here is create and maintain leverage. Which one's right?
Let me double check. I even went through it this morning to make sure I had everything on there because I did this last month. Are you guys still seeing my screen?
Strategy
Okay.
2, it's on the first slide of the Jamboard. Strategy 2 is to create, maintain, leverage cross-sectoral partnerships. The other one, the workforce one, is strategy 1. And it was ranked dead last, so it should be later. So Katie, if you'll just change that after the meeting. So,
Yeah,
thank you. Can you hear that, guys? That like high pitched sound? Okay, good. Like the wind blows through my apartment and then like the shutters like make it whistle. It's like interesting. Okay, so what barriers to success? What are some barriers that local health departments have in developing these for physical activity?
Other competing fact or priorities. So not seen as important.
Yeah. Anybody else?
Is there a lack of experience? I'm asking because I don't actually know, but are there really physical activity experts within health departments?
Not in our health department, I will say.
I don't, but there's none in Casey Mill. And
Besides
even, like,
you?
well, I'm not there anymore anyways, but
Oh.
yeah, but I think even people who would claim to be experts don't have training in physical activity, right? They have training in like something else, like social work or, you know, I don't know, something else. And then they maybe played sports or did something else. And so they claim to be like the physical activity person, but they have no public health physical activity expertise. Yeah. Am I right on that, guys? Yeah. So how do we overcome these barriers?
Identifying the gaps and the partnerships to close those.
Yeah,
What did more? Sorry, Sandy.
oh, that's okay. I was gonna say training, training to make people feel more comfortable and more knowledgeable about physical activity.
And then I also think looking for partnerships that provide you with the expertise that's needed. So if this strategy is about leveraging cross-sectoral partnerships, it's, unless you're a healthcare system, I don't know how in the world you're going to have an expert in everything if you're a health department. Nor should you necessarily have to do that. So how do you identify where you need additional expertise and then seek out that partnership?
Yeah, great point. That's a good thing that we can, that is a good way to overcome that barrier, right? Like partnerships to physical activity experts.
Exactly.
Mhm.
And that's where I think bringing in academic and, you know, relationships with academic institutions or health systems or Parks and Rec, or, I mean, any of these areas that might have the expertise that you need. And then I think that's really what identifies the win-wins, because there are benefits going both ways.
Yeah, agreed. Who else are we missing, guys? Shelley mentioned a couple.
Yeah, I think Parks and Rec. Oh, so I mean, obviously we're a health system, but I think we're missing broader health systems, you know, like adults. We cover kids well, but we don't cover adults. We're missing that. I also think potentially FQHCs.
Do FQHCs have physical activity experts? Not really, right?
I
They're
don't
they're
think so.
in the same boat everybody else is in. Yeah.
It'd be like any general practitioner to me. You're lucky if you have anything besides the provider. I mean, it sort of depends. Are you seeing patients within a health system? Are you seeing patients as an individual practice? And then how do you, I think of an FQHC more as an individual practice versus a health system, but sometimes
I mean, yes and no. I think that like the FQHCs are good at what they do. And so like I think Casey Care is like the great HIV clinic, right? And then Swope is like really good at like other infectious diseases and behavioral health, right? And then, I don't know, yeah, yes, and
Well,
Yeah.
yeah, it's figuring out which ones they have, because I mean, you're saying right, and I don't know that they are good in those things, so I'm gonna trust that you do. Some of
Yeah.
them have dietitians, some don't, some of them have
lacking,
yeah,
for sure.
mental health providers, some don't, and so I think it's,
I would agree though, Shelley, that I don't think any of the FQHCs have a physical activity expert. Like,
right, I think
and
that's
again,
true.
if somebody is a physical activity expert, they're not trained in physical activity, they're trained in like social work, and then they,
Or nutrition. I mean, like, I
Yeah.
think there are a number of dietitians who might have a master's in sports nutrition, exercise, like me, mine's in exercise physiology. Or
Shelley-
something related, but they're not.
Yeah.
You know,
I mean, you're more physical activity than I am, Shelley. X-Biz, come on.
yeah, boom.
Guys, I've never taken an anatomy class in my life.
Seriously?
Yeah, I never went.
Shelley.
I did not. My undergrad's in biology. I got a master's in public health and a PhD in kinesiology. And like, I've never needed an anatomy class.
How is there not anatomy required in kinesiology or
Yeah.
biology?
Well, there is for undergrad kines, but my undergrad's not in kines. And so Yeah. I've taken one physiology course in my life, advanced exercise physiology. And I walk up and I'm like, guys, I know nothing. Where's the pericardium? What
I
is
guess
this?
I'm the expert.
Yeah, right.
Boom.
I'm a behavioralist. I'm not a, you know, anyways, I've learned, guys. It's been years. I've learned something. Okay, let's move on to slide 9. So again, thinking about like strategy prioritization, I think most of us are in this like quick wins category, right? Somebody is like in the potential, like wants to be on the cusp here of like start hearing quick wins. You have to pick one. You can't. I'm kidding. Whoever that is. Anybody else, feel free to jump in and put your number wherever it goes. For ISIS and others, yeah, so at the top we have easy and hard on difficulty level, and on the left hand side we have low impact or high impact. All right, so let's just have a quick wrap-up conversation about this. What do you guys think? So it seems like we're a little kind of all over the board. Is this something that we want to prioritize? Is it not? What do you think?
Sorry, how do I undo my little drawing there?
I think you just pick it up, right? Like click on it and pick it and move it.
I think you
Oh,
have to,
yours.
yeah, you have to use the eraser.
Ah, okay, sorry. Continue, I'll just work on it.
Katie can probably erase it too.
It's not letting me.
Oh,
I think
Sandy.
you have to do it.
way to mess it up, Sandy. God.
Sorry.
The undo button at the top, Sandy.
Yeah.
The undo, oh, there we go. I didn't see it before. It's not letting me. It's not letting me undo.
You know, it's okay. It's not interfering with anything, so.
Okay, sorry, continue.
Okay. Any other last words on this one? Do we want to prioritize it? Do we not? We ranked it originally pretty low.
What are we currently prioritizing?
So we
Or-
have the 6 strategies, right? And I think we want to get to however many, it could be all 6, it could be 3, it could be 2, it could be 1, however many strategies, right? That we want to then develop interventions to fix, right? So the Healthy Lifestyles Collaborative has funds that we can apply for to do interventions to help start working on these things. So if it's like training public health staff on physical activity, we can move that forward. If it's something else, we can do that. So essentially, over the next however many years, what do we want to focus on, and what do we think is the the things that we can do in order to improve public health's ability to impact physical activity? Any other words on this one? Okay, so we have
So
Go ahead.
Let me just jump in there. I think that this is so in my opinion, based on where we are right now, we have cross-sector. We have this work group, which is a cross-sector partnership. We're beginning to identify who might be missing. I think that would suggest that this is easier to do and complete than what the ranking might suggest. So 5 to 10 years is a 4.2, 3 years is a 3.6. Feels like we could probably get a good cross-sector partnership, identify people who might be missing, pull them into this group as we begin thinking about what are the implementation strategies that we want to do and how do we do this better, especially since we have 8 other work groups already moving forward that might have experts and participants that can move us into action a little bit more quickly. So in my opinion, I think this is one of those things that if we had it as one of the top things that we're working on, could be something that could be very effective in the next 3 years.
Other thoughts?
I agree with Shelley. I mean, I think we're kind of already doing this and just kind of seems like a low hanging fruit and you can easily get this done.
I mean, from my experience, right? Like I have 2 competing demands in my head, right? So on one hand, I think that like there's a lot of partnership and a lot of stuff and nothing ever happens, right? That's one side of me. On the other side is Shelley and my relationship in the past that has led to federal funding, that has led to a lot of different stuff that has like really changed the physical activity environment for some folks, right? And so, you know, the work that Shelley and I have done together has like really changed stuff. And so partnerships and, you know, coalitions, if done right, I think are very impactful. And so that's where my brain is at. On the one hand, I'm like, on the other hand, I'm like, yes, right? And so I don't know how other people feel about that.
I feel like you have to have like doers in your group. I feel like at least for some of the other like coalitions that I'm on, like there's like one person that's leading it and like trying to get people to like do things, but it's really just that one person doing all the work. So I think you just have to have the right people and basically like the champions of that organization, if that makes sense.
And to add to that, this is DC, by the way, Johnson County Health Department. To add to that, also having a partner that has some of the infrastructure put together already, or has people that they can kind of integrate some of the information to. Like, for example, schools are very decent or very good resource because they have a ton of people, they have an infrastructure for whatever, with physical activity, for you know, talking to parents or to adults, talking to kids. They have a huge population already that we could tap into all over the metro area. So one person championing it, but then also a partner that has access to a lot of people and influence to those people. So
I think this conversation is really useful when we think about implementation strategies, right? So if we want to prioritize this one, let's figure that out today. And remember this kind of talk when we're thinking about what we want to do in order to move it forward. Cool. All right, we have 2 more. I really want to get through this today, and we're already half an hour in because, you know, this stuff is important. So let's move on to the next one. So strategy 6, public health agencies should invest equitably in physical activity commensurate with its impact in disease prevention and health promotion. So is this already being done? I'm like, I would say no. There's little to no funding for physical activity. What do you guys think?
I agree. I feel like especially when it comes to like disease prevention, it's always more emphasis on like the treatment of it.
Yeah.
Instead of the prevention.
I would also say, I mean, this is my read. I think the funding is at the federal level and so locally, there's very little appetite to fund public health for physical activity, right? There's funding at the federal level, but because there's very little expertise in physical activity in local health departments, and those grants are, you know, big things to write, it never gets to a local health department. What do you guys think?
Which I find so odd. I mean, when there's mountains of evidence that would suggest that the best treatment for chronic diseases is physical activity. And yet we can only get somewhere between 20 and 25% of the population to meet physical activity guidelines.
It doesn't make money. I think, I mean, in the long run it will, but like in the short term, I think there's more thoughts of like, how can we do something that will be a quick fix to the health issues that we're having, as opposed to, you know, there is no quick fix. You have to take care of yourself in all aspects. And I don't.
Sorry, I was muted. Who can implement this if health departments aren't doing it, right? Who can help out? So I just put in here like grant writers, academics, other agencies applying for grants, making sure that health departments are at the table. This might lead into Shelley's, you know, comment around partnerships. Who else?
I would think Parks and Rec.
Yeah. Parks and Rec is funded to do this stuff, right?
Right?
And so where's the link between public health and Parks and Rec?
Aren't they both government agencies?
And they're usually in the same government agency, right? Like they're usually like in a city or a county.
Yeah. Funding taxpayer dollars that are going to support both.
Yeah. Yeah, that's a good point, that like I think a lot of Parks and Rec is focused on specific populations and not on population health, right?
I think that's true of everything. We often get caught in specific populations, which I think sometimes bleeds into the whole community, but sometimes doesn't.
Yeah. Well, it often doesn't bleed, like, how is it often doesn't lead to those folks that are marginalized being active, right?
Well, and I think there's a chronic systemic problem in there. And it's, I mean, twofold. One is creating the demand individually.
Yeah.
And then the other is, okay, once the demand is created, helping to meet the demand. And
We need
you
to,
know,
like,
is there
we need some behavioral economists, right?
there
To be
there you
like,
go. Wouldn't that be nice?
that
Yeah.
thought process is really valuable. So what are the barriers to success here? I'm gonna say competing demands again,
Mhm.
right?
Yeah. Money,
Uh,
expertise, creating the right partnerships.
Local expertise in local health departments to do it, right?
Mhm.
How do I, what was that?
Funding,
Funding,
you
yeah.
said money.
Yep. How do I say like appetite, right? There's not an appetite to even go after these things, you know? So how do we overcome these barriers?
We need lobbyists.
Yeah, we do. What else? Who else, I guess? Or how else? And these lobbyists might be us, right? It might be like an advocacy group.
We may need lobbyists in quotes.
Yeah. I'll fix that. That's a good idea, Shelley.
Cheerleaders.
Might be a yell leader instead of cheerleader.
Okay, I'm in.
Well, who else? How else? How do we get this? How do we overcome these barriers? Can I say like educating local health department leaders and legislators on
Community leaders as well, like, you know, there inside of communities, there are leaders, and sometimes they can help, you know, I guess, individual communities with their own, you know, organization. Sometimes that's even better in many cases. And they have more passion to do it because they're suffering that particular thing, I think, you know? So I
Well,
guess, yeah.
but
No, I guess it's like the cheerleaders or the influencers. You know? Yeah.
I think a lot of those folks too serve on local boards of health or city committees or commissions, you know, and so, you know, those people have influence and can push something forward as well, right? Who are we missing from this work? I think Isis mentioned it already, community members, right?
Parks and Rec keeps coming up, so are we missing them from the conversation or in this group?
Yeah, has there ever really been, I mean, other than, has there really been any like local leaders that talked up physical activity in recent years? Have you guys ever heard of that?
They often come together for a purpose, right? And then they like, it's like everybody comes together to do something and then they all go away. So I'm thinking of like the Complete Streets Ordinance in Kansas City, Missouri. Like everybody kind of, American Heart Association, like everybody came together to get that thing passed. And then it got passed and then like, it's not implemented. And like it all, you know, the coalition disperses after that's done. Is that everybody else's kind of perspective too?
So there's
Yeah.
there's no body put in place to implement or to maintain whatever policy has been put through. Is that?
I mean, like the city's supposed to implement it, right? But like, unless there's somebody following up on stuff, no.
Yeah, it sort of depends. I think people have tried to do that in the past and then people change positions. And if that champion doesn't stay in, their position is not necessarily filled by another champion. That's
And
impacted some of it.
I'm in Mexico, so I teach. I'm not in public health, but I teach students who are in the career of public health, and they, for example, we see violence as a disease, for example, and the way they organize is precisely like the way you're mentioning it now, Joey. And you know, for example, in Juarez, there's this big problem of violence. At the beginning, it was only for the poor people. It was a problem with poor people, but then it's a problem with the rich people. So they all had to organize from, you know, lower class to upper class, and then politicians and, you know, entertainment industry and everyone, in order for to lower the crime rate and violence in Juarez. And they kind of did, but it also depends on politics, unfortunately, in many ways. So when they change the politics, every governor or, you know, mayor, etc., and then it just starts going down. So yeah, it kind of goes like that too. But yeah, it's interesting.
Isis, where are you in Mexico? Are you in Juarez?
I am in Chihuahua capital. The capital, Juarez, is about 4 hours from here, but
Yeah.
we see all that. Yeah, the women, you know, what's it called? The cotton fields and things like that. So we analyze it precisely like that in public health. And yeah, it's a big thinking problem here.
Do you study physical activity or?
No, I actually teach them the sociological, anthropological aspects of public health more so, the projects, how they can do projects and precisely bring the community in so they can work, because it's actually been one of the most active things that they've had, even though it's been short terms for political times. They do get to organize and do something about it. And of course, later on they disperse. But yeah, that I help them understand how you can build programs and how you can make people actually get involved inside of the community. But yeah, so.
Well, we will have to chat after this because I work at UMKC in Kansas City, but I live in Puerto Rico.
Oh,
So,
that's cool.
Yeah. And I think I'm guessing we have a lot of similar interest, and like the stuff here is very much like that, right? It has to be grassroots or it doesn't work. But
Exactly. That's basically what we do. Mhm.
yeah. So let's I want to get these two things done. So let's keep moving forward here. So how would we like prioritize this strategy? Go ahead and grab a number and place it where you think it belongs. It looks like we're kind of all on the same board, right? Like this is really important stuff, but like figuring out the money and getting like local funds or long-term sustainable federal funds in this game is going to be really hard, right? You guys anybody want to chat? Like, let's give it like 2 minutes. Any highlights from this strategy that you want to say right now? Okay, let's move on to the next page. So the last one is about workforce. So public health organizations should develop and maintain a workforce that and with competency and expertise in physical activity and health, and that has ethnic, cultural, and gender diversity. So is this already being done? What do you guys think? Oh, so I said, did it go away? It's on your screen, Katie. It's not on mine. So I said no for physical activity for sure, right? Like nobody's focused on physical activity, but it is being done for like this ethnic, cultural, and gender diversity aspect, I think. Is that KCMO or is that everywhere? Yeah, Sandy's shaking her head, yes.
Yeah, so we, when I started at the health department 20 years ago, we had probably 99% women in the health department of Johnson County, and most of them Caucasian women. And now I'm definitely seeing a few more men, definitely more ethnically diverse. So that has definitely improved. But I think especially in Johnson County, as you can imagine, it started out years ago as a lot of women. So it's getting better.
Yeah, I would agree with you. And I think racially too, health departments, I think, are becoming more racially diverse. Yeah, it is female dominated workforce, right? So like the one place I am diversity is in public health, right? Which is crazy. Okay, so who can implement this? So who can change kind of workforce, competence, expertise, and physical activity, and the breakdown of the workforce. So I said academics, I think academics have a role in helping with the expertise aspect, and then local health department leaders are really the people who hire who they're going to hire, right? Who else? Anybody else?
What are the city or state roles with health departments. And I'm thinking about like the Kansas City, Missouri Health Commission and its relationship to the health department. Does that exist in every city? Is there a health commission in every city that helps, I don't know, direct,
Yeah.
advise, whatever, health departments?
Yes and no. That's the easy answer. So legislatively, the way it usually works, Shelley, is that there's a local board of health that is the kind of the final say in health in a jurisdiction, right? Most jurisdictions are counties. Only a few city health departments have city jurisdictions, and that's the only reason KC-Mo has a city jurisdiction is because we have a city election office. So, like, if you go to vote in Jackson County, but you live in Kansas City, Missouri, your election office is actually in Kansas City, not Jackson County. It's a very like weird system. No one else besides Independence, which also is different because that's not true in Independence, has a city health department, right? So it's a mess. But there
Well,
is this-
however they do it, that group could, I mean, I'm looking at like the add or remove barriers. I would think that group could add or remove barriers related to maintaining a workforce with competence.
Yes, I would say that sounds really good. In reality, so Johnson County, right? Sandy, correct me if I'm wrong, but Johnson County, the Board of Health is made up of the county commissioners, right? And I think it's 3 county commissioners or something like that.
I think
All of them?
I think it's a little bit, well, it could be just 3.
Yeah. And it's like a separate, it is the group, but a separate group. And so those county legislators, they don't talk about anything on the Board of Health. The Board of Health meets and they like, when they need to meet in a corner at the, county office, like it's not as regimented. They don't meet monthly. It's not as regimented as we think it is. It's like, they would meet if like the county health officer, who is the director of the health department, does something wrong and they need to like punish them. Like that's why they would meet. It's terrible. The health commission is actually an advisory board of health. It's not the legislative board of health, which is, but let's put it on the list. Sorry, I didn't mean to. Let's put it on the list. It's a mess. Public health, it's a mess. So how do we overcome what are the barriers? Sorry, what are the barriers to success here? I would say just lack of training among local health department staff, right? And can I say the pipeline? Like there's very few students or staff incoming that are trained in in physical activity. Lack of applicants, that's a good point.
Promotion of that education or that I don't want to say degree, but that would be good. Promoting that in lots of different ethnic groups.
I can speak to that a little bit, just that I completed a public health degree at K-State and there was not a lot of diversity and it was all girls. And over half our lab was foreign students, but they were all Fulbright students. So they went back to their country to practice once they got their degree. So none of those foreign students are entering the field here.
And dietitians are the same way. I mean, we're mostly women, getting a little more diverse, but.
And the men dietitians are like quacky, right? They're like, oh, you have to like eat 4 pounds of beets before a workout or something, right? Like,
That's not my experience.
really? Okay.
Mm-mm. They've been
I
great.
knew those guys in
Yeah.
my group.
Depends on the man.
I'm sure, just like it depends on the women, but
Right.
I've been lucky enough to be around, the male dietitians I've been around are smart. They're in different areas, like one's in business, one's in food service, many are in the clinical setting. One actually went to evidence-based practice. So thankfully, well, I mean, I guess I haven't had the quirky ones.
I haven't really had one I can think of.
I added one more barrier. There's not really any programs to train current staff except for like the public health program, public health physical activity program at South Carolina, right? That one is really the only one. And so somebody should work on that, which we're working on slowly but surely. Okay, so how do we overcome this barrier? So we can promote physical activity as a degree, which K-State is the only one that has a physical activity focused public health degree. What else? Develop a training program.
More emphasis on the advantages of physical activity with your physical and mental health. I think the more people know how it affects you positively, the more they'll kind of be guided to that, to physical activity.
So like more focused on the benefits of physical activity.
Yeah.
Okay, cool. And then who are we missing from this? I would say the workforce, but we do have, you know, Sandy and Chelsea here, and DC, and so you guys are all kind of in the workforce. But I think you guys are anomalies, right? Like to care about physical activity and this stuff is unusual.
I feel like, I mean, the reason why I'm passionate about it is because it's definitely, yes, we can, what we put in our bodies is important, but it's also important to move your body, and in the long run saves us so much money. We all know, as a community, as a state, as a country. So just making everyone feel more comfortable with education, because I feel like, you know, that wasn't my focus in school. So feeling more comfortable with educating other people would be good.
That's a good point. I pulled out of that like economics people, right? Like the cost benefit of physical activity. I think we need to do a better job of highlighting that. And then is there a way, who are we missing in terms of like educate? Are we missing academics? Me. Sorry.
Feel like we're always missing academics.
It's good to be missed, I guess. Okay, let's move on to the next page. So strategize it, or prioritizing the strategy. Difficulty and impact. All right, so let's talk through this real quick. So we have 4 minutes. Let's talk through this, and I don't think we're going to get to like being able to pick our strategies today, but hopefully we can do that in June, or I guess, you know, the next one. What do you guys think? So I think a lot of us are on the same page. It looks like a lot of us are on the same page that this is really hard to do, but the impact is really high and sustainable if we do it, right? There's one person who thinks this is a quick win. Do you guys want to talk through that?
Well, I think that's because of where I work, Johnson County. They kind of incentivize physical activity for their employees. So you get you get to, you decrease the amount you have to pay towards your health insurance if you complete so many physical activity goals throughout the year. So that's kind of an advantage we have a little bit.
So
Um,
DC, sorry, go ahead. I don't want
no,
to.
go ahead.
So this is really interesting because the way I was thinking about this is like having staff to like deliver programs, not the staff themselves being active, right?
I think in my brain went to like, if the staff is themselves being active, then they're more likely to advocate for activity outside of the health department. So
Very true. And we all work towards that goal every year, because we don't want to pay more for it.
right, we
Right.
don't want to pay extra.
I think that's a great implementation strategy. So if we're thinking about, really focusing on this strategy, then, using that as a potential mechanism of change, right? Of like, let's do an intervention to get health department staff active, which a couple of my students have done, and they're pretty successful, honestly. And if we can do that, then maybe we can get people excited about physical activity, get them trained in physical activity, and really kind of change the environment within the health department that then translates into community health. I think that's a really cool thing.
I agree.
2 minutes left. Shelley?
Well, so this aligns with other cross-sector implementation projects we're already starting. I mean, and a quick one could be health department staff participating in our Just Walk walks. Whether it's participating as a volunteer or participating as a healthcare lead, like sharing some information related to something in the health department, whatever it is, vaccines, what services the health department offers, etc. It could be just as a participant, show up and just do the walk, you know what I mean? Just to be active. But that's one current opportunity that's ready to go. And then there are other opportunities that could be a little bit closer to where people are, like around the city, could be in relation to schools or early childcare settings or all kinds of things. So I think that's something that is a need. This is where cross-sector partnerships of the PA plan could be really valuable. How do we get people engaged immediately? Well, here's how.
So great conversation today, guys. Thank you all for being here. Next time, Katie, when's the next meeting? June.
June 22nd, it'll be at noon. And then the one after that will be July 20th. So we will have 2 meetings in June just so that we can speed up the process. And
But
I'll
it's
be
June
sending an
1st.
Eventbrite out later today.
It doesn't feel like June 1st. It feels like May still. So we'll chat in a few weeks. Great to see everybody. Thank you all for being here, and think about which strategies you want to prioritize and pick so that we can move those forward. It might be all of them. It might be just a few, but that's up to this group to decide. Have a great day. We'll see you in a few weeks.